Hello, and welcome to the PAHO podcast, Turning the Tide, NCDs, Mental Health, and the Urgency of the United Nations High-Level Meeting. This is a space where we have a conversation with experts on NCDs and unpack these most pressing health issues. And I'm your host, Silvana Luciani from the PAHO NCD program. And I'm really excited to bring to you all that we're doing at PAHO with governments, civil society, academia, and the public to prevent NCDs, promote health, and improve the health system response for better care for NCDs. Today, we're discussing the fourth high-level meeting of the United Nations General Assembly on NCD prevention, control, and mental health promotion. And in this episode, we're focusing specifically on NCD surveillance. And joining us today is Dr. Roberta Caixeta, the Regional Advisor at PAHO on NCD surveillance. Welcome, Roberta, and thank you for being here with us.
Thank you so much for having me, Silvana. It's an honor to be part of this conversation.
So let's start with the basics about NCD surveillance. What can you tell our listeners about what it is and why is it relevant to the discussions of the UN high-level meeting on NCDs?
So NCD surveillance systematically collects and uses data on non-communicable diseases, their main risk factors, mental health, and health system responses. It shows the scale of the problem, highlights inequities, and tracks whether policies and interventions are protecting everyone. This UN high-level meeting is calling on countries to strengthen their surveillance capacity by implementing population-based surveys like STEPS and by improving death registrations and facility-based information systems. The declaration also sets a clear target for surveillance, aiming for at least 8% of countries to have operational NCD and mental health surveillance and monitoring systems by 2030. And let's not forget, surveillance is what will help us to keep track of the proposed UN high-level meeting declaration goals, which are 150 million fewer tobacco users, 150 million more people with controlled hypertension, and 150 more getting mental health care. It's how we all stay accountable.
Thank you. So, you make really good points that NCD surveillance is about keeping ourselves accountable to meeting the targets that we set in the NCD agenda. And that it's also NCD surveillance, a really important essential public health function that provides really critical data to inform our policies. And you've highlighted a little bit about what you can expect from the UN high-level meeting on NCDs, and it will no doubt bring a really strong resolution calling for bold, accelerated actions to reduce NCD surveillance, and that there will be, as you've already mentioned, a call on improving surveillance systems. So what can we expect as a result of the UN high-level meeting for NCD surveillance agenda in the Americas region?
So the meeting is placing renewed emphasis on the need for timely, reliable, and disaggregated data. Countries are encouraged to make greater use of digital tools for NCD surveillance and strengthen facility-based information system. Want to see stronger global and regional collaboration, investment in data systems, and more attention to make sure surveillance captures the needs of vulnerable and underserved populations.
Wonderful, wonderful. So more attention to surveillance systems, more global and regional collaboration for NCD surveillance, and more timely data on NCDs. And we know, Roberta, that PAHO has been building capacity on NCD for surveillance for many, many years. And this has resulted in the creation of many NCD data products, like, for example, the PAHO Enlace data portal, where all the current information on NCD mortality, on NCD risk factors, can be found, as well as our flagship publication on NCDs at a glance that provide information and trends by country on NCDs. So how can the results of this UN high-level meeting support PAHO's efforts in NCD surveillance and help us advance on these many wonderful data products?
Yeah, this is very important, Silvana, that commitments from the UN high-level meeting can reinforce PAHO's works by creating political momentum and unlocking resources to scale up surveillance. For example, they can help us expand the use of standardized tools such as STEP surveys, strengthen cancer registries, and integrate NCDs and mental health data into the national health information platforms. They also give legitimacy to our ongoing efforts to build capacity, promote regional comparability of data, and ensure that surveillance informs policy decisions, which is our ultimately goal.
So, Roberta, as we wrap up, what's your final message about NCD surveillance to the policymakers, health professionals, and everyday listeners to this podcast?
My key message is, I think, is that data can save lives by uncovering the invisible. Surveillance is not about numbers on a page. It's about making sure we have the right information to guide prevention, treatment, and policies that improve health for everyone. For policymakers, I would say invest in data systems because we know it is hard to manage what we don't measure. And for health professionals, I would say use data to inform your practice and also to advocate for better resources so you can respond better. And for the public, I think it's important to remember them that your participation in surveys and in screening programs directly contributes to building healthier societies and especially to providing better care for you. So that was my main point, Silvana.
Thank you, Roberta. Thank you so much for sharing your insights on NCD surveillance in the Americas. And to our listeners, thank you for joining us today. I really hope we've brought you some new information and inspired you to work on NCD surveillance. And if today's episode resonated with you, please share it in your networks. And please also visit the PAHO webpage where we have a lot of data on NCDs and a lot of tools like the STEP survey that Roberta mentioned to help build NCD surveillance capacity. So together we can turn the tide on NCDs and mental health and protect the well-being of future generations. So until next time, stay informed, stay engaged, and stay healthy.